A heated controversy has erupted in Maharashtra as doctors strongly oppose the government's recent decision to allow homeopaths to register with the medical council and prescribe modern medicines after completing a short pharmacology course. This move has sparked intense debate about the safety and integrity of healthcare in the state. But here's where it gets controversial. The Indian Medical Association, IMA, has not only voiced their objections, but has also threatened to call a strike if the government does not reverse this order. On June 30th, the Maharashtra Medical Council, MMC, issued a notification revealing that the state's Medical Education and Drugs Department has approved a certificate course in Modern Pharmacology, CCMP, specifically designed for homeopathic practitioners. This course would enable them to practice modern medicine, a decision that has alarmed many in the medical community. In a strongly worded letter to Chief Minister Devendra Fadnavis, the IMA expressed deep concern and outright rejection of the directive that instructs the MMC to register homeopathic practitioners who have completed the CCMP. The letter emphasized that this course, which lasts only 6 months with limited weekly classes, falls drastically short of the rigorous training required to safely practice modern medicine. To put this into perspective, an MBBS degree demands 5.5 years of study, covering 19 subjects, extensive clinical exposure, and a mandatory internship. In contrast, the CCMP is a brief orientation with just 2 days of instruction per week, insufficient to build the critical knowledge, clinical skills, and sound judgment necessary for treating patients effectively. The IMA warns that this disparity could jeopardize patient safety and the overall quality of healthcare services. Allowing practitioners with such limited training to prescribe modern medicines could lead to serious consequences, including misdiagnoses, harmful drug reactions, the rise of antibiotic resistance, and even fatalities, especially in underserved rural areas where medical oversight is already limited. This is not the first time Maharashtra has ventured down this path. In 2014, amendments to the Maharashtra Homeopathic Practitioners Act and the Maharashtra Medical Council Act permitted homeopaths to prescribe certain modern medicines under specific conditions. However, the IMA highlights that this latest move crosses a legal and ethical line. According to the National Medical Commission, NMC, and State Medical Council regulations, only those holding an MBBS degree are legally entitled to receive licenses to practice modern medicine. The IMA argues that the CCMP is merely an introductory course and granting full registration based on it is legally questionable. They caution that this could open the floodgates for other alternative medicine practitioners to demand similar recognition, potentially leading to chaos within the healthcare system and eroding public trust in medical professionals. Moreover, the association points out that such a decision could damage the international reputation of Maharashtra's medical education and healthcare standards, which have long been respected. In their appeal, the doctors' body reminded the government that healthcare is a solemn responsibility of the state and urged immediate reconsideration to safeguard the health of Maharashtra's citizens and uphold the dignity of the medical profession. They specifically requested the withdrawal of the government resolution dated September 5, 2025. Failing that, they warned of escalating their protest, including a 1-day statewide token strike scheduled for September 18, 2025, during which all healthcare services would be halted for 24 hours. Adding to the tension, the IMA has challenged these amendments in the Bombay High Court and insists that no further steps be taken until the court delivers its verdict. This situation raises important questions. Should practitioners of alternative medicine be allowed to cross over into modern medical practice with minimal training? Could this blur the lines between different medical systems and compromise patient safety? Or is this a necessary step to address healthcare shortages, especially in rural areas? We invite you to share your thoughts. Do you agree with the IMA's stance, or do you believe the government's move is justified? Let's discuss in the comments below.